She watched him back away from the table. Not hesitate, not falter. Back away. The patient's chest was open, blood sheeting across the surgical drape faster than the suction could clear it, and Dr. Victor Hale, Port Sterling's most celebrated trauma surgeon, the man whose framed magazine cover hung in the hospital lobby, took 2 steps backward and let go of the retractor like it had burned him. The monitor screamed. The scrub tech froze. And in the doorway of Trauma Bay 1, night shift nurse Mara Ellison stood watching the most decorated hands in Riverview Medical Center hang useless at the surgeon's sides while a man died on the table in front of him. That was the moment everything cracked open. If this story moves you, if you've ever been overlooked, dismissed, or told to stay in your lane, follow along to the very end. Like this video and drop a comment telling me what city you're watching from. I want to see how far this story travels. The night had started badly before it became catastrophic. Mara had pulled a double, 12 hours already behind her, her feet past the point of pain and into something more like numbness, when the first ambulance came in at 9:47 p.m. A single casualty, male, mid-50s, blast injuries to the lower extremities. She'd heard the call on the radio while restocking the supply cart outside Bay 3, and she'd stopped moving. Not because the call was unusual, because of the specific language, blast injuries, multiple fragmentation wounds, hemodynamic instability. She knew what that combination meant before the doors swung open. The paramedics came in fast, 2 of them, working in that tight, urgent rhythm that meant they hadn't stopped compressing since the scene. Behind them, a second gurney, then a third. Then the radio crackled again and the dispatcher's voice came back, no longer controlled. Riverview, be advised, you are receiving mass casualty. Repeat, mass casualty event. Bombing at Caldwell Station. Estimated 40 to 60 civilian casualties incoming. All available trauma activated. The charge nurse, Deborah Wills, was already moving toward the desk, already dialing. Around her, the quiet, organized rhythm of the late-night ER began to fracture. Someone knocked over a tray. Someone else was on the phone saying, "We don't have enough bays. We don't have enough bays," like saying it twice would change the math. Mara was already gloved. She'd pulled the cart to Bay 1 before anyone told her to, had the IV lines primed and the crash equipment checked by the time the first critical came through the doors. Police officer. Badge still clipped to what remained of his uniform shirt. The left side of his chest was wrapped in field dressing. Someone at the scene had done it fast and not quite right. Compression good, but the seal incomplete. And his color was wrong. Not pale. Gray. The particular gray of someone whose body has already started the quiet process of redirecting blood away from everywhere it doesn't absolutely need. Bay 1, Mara said to the paramedics. Not a question. They swung the gurney in. She caught the end rail, helped guide it into position, her eyes already moving over him. The labored breathing, the way his trachea sat just slightly off-center, the distended neck veins, the absent breath sounds on the left when she pressed her stethoscope to his chest for 3 seconds. She didn't need 3 seconds. Tension pneumo, she said to nobody in particular, because the attending hadn't arrived yet and the bay was still just her and the paramedics and a respiratory tech who was 2 years out of school and looking at her for direction. He needs a needle decompression right now, and he needs a chest tube inside 10 minutes, or we're losing him. You're not losing anybody. Victor Hale came through the bay doors like he always entered a room, as though the room had been waiting for him. He was already in his scrub cap, mask pulled down around his chin, moving with the particular ease of a man who'd spent 20 years being the most competent person in every space he occupied. Behind him came his fellow, Dr. Tanner Oakes, who was young and quick and watched Victor the way young residents watch surgeons they want to become. "What do we have?" Victor said, not to Mara, but past her to the paramedic. The paramedic gave the handoff. Mara listened to make sure they got the tracheal deviation and the absent breath sounds. They did. She watched Victor's face as he processed the information, the slight tightening around his eyes that meant he was already building the picture, and then she said, "I think we're looking at a tension pneumothorax with early signs of hemorrhagic." I heard the paramedics. He moved to the patient's right side, snapped his fingers for the stethoscope, listened for 4 seconds. "Decrease left side sounds. Get me a needle, 14 gauge. "Already drawn," Mara said. She held it out. He took it without acknowledging that she was the one holding it. She didn't say anything. Outside in the corridor, the sound had changed. The ER at Riverview normally ran at a specific ambient noise level: monitors, conversations, the occasional code alarm. Right now it sounded like the lobby of a building that was on fire. Voices overlapping, gurneys colliding, someone calling for blood, someone else saying a name over and over that no one was answering to. The mass casualty protocol had been called, which meant every off-duty trauma physician in Port Sterling was getting a phone call right now, which meant for the next 20 to 30 minutes, Victor Hale and 2 residents were what Riverview had. Mara knew that. She suspected Victor did not fully appreciate what that meant tonight. The needle decompression worked. The officer's oxygen saturation climbed from 78 to 91 in 40 seconds, and Victor straightened up with the satisfied look of a man who'd solved the problem. Mara was already setting up for the chest tube, drape laid, instruments counted, local anesthetic drawn. "He still needs the tube," she said. "I know he needs the tube, Ellison." He said her name the way people say a word they find mildly irritating. "Can you do that without narrating?" "His pressure's dropping," she said instead. 78/50. He was at 90 on arrival. "That's why we're doing the tube." "His abdomen is also rigid, left lower quadrant." Victor paused, looked at her for the first time, not with curiosity, with the expression of someone who has just noticed a junior colleague talking when they weren't asked to. "Did I ask for your assessment?" "No." "Then—" "He has blast injury to the left flank." She kept her voice level. She'd learned a long time ago that volume didn't win arguments. Clarity did. The mechanism is high explosive fragmentation. Tension pneumo plus a rigid abdomen in that context could mean splenic laceration or a mesenteric tear. The chest tube will help, but it won't address the abdominal bleed if one's present. Victor looked at her for a moment longer than was comfortable. Then he turned back to the patient. "Get me the tube set up, and stay in your lane, nurse." She stayed in her lane. She set up the chest tube, passed the instruments in the correct order, kept the field clean, tracked the drainage, 200 milliliters in the first 2 minutes, which was high, which she noted in the chart and said aloud, which Victor ignored. The tube went in cleanly. The officer's SATs climbed to 96. Victor said, "Good," and Mara couldn't tell if he meant himself or the numbers. Then the next gurney came in, and the one after that. Hook. By 10:30, Riverview's emergency department had received 22 casualties from Caldwell Station and was expecting more. The bomb, or bombs, the reports were still unclear, had detonated during the evening commute in the main concourse of the city's central rail hub. The specific kind of chaos that follows an event like that is different from other kinds of chaos. It isn't random. It has a pattern: the walking wounded first, the ones who can move under their own power and therefore move fast, then the moderate cases, then, in the final wave, the critical ones, the ones who required the most resources at the scene before anyone could move them. Riverview was in the moderate phase. The critical wave hadn't arrived yet. Mara knew this. She'd helped Deborah rearrange the department, turned the hallway bays into overflow, pulled the chairs out of the waiting room to make room for the ambulatory wounded, called the blood bank 3 times until someone picked up and confirmed the O-negative supply. She'd done all of this while also cycling between 3 active patients, 2 of whom had injuries that required constant reassessment. She had not eaten since noon. She had not sat down since 7. Victor was in Bay 4 with a teenage girl who had fragment wounds to her right arm and shoulder, non-life-threatening, and he had been in there for 11 minutes, which was 9 minutes longer than that patient's acuity required. Mara knew why without looking. The girl was the kind of badly hurt that was still manageable, the kind of case where a surgeon could feel effective without being tested. Victor was good in a crisis up to a certain threshold. Above that threshold, she suspected, something else happened. She didn't know yet how far above that threshold tonight would go. She found out at 11:04. She was in Bay 2, 40-year-old male, femur fracture, blood loss controlled, orthopedics coming, when she heard the tone change in Bay 1. The specific triple beep of the monitor alarm that means the heart rate is doing something wrong. She was through the door in 6 seconds. Officer Reddick, she'd read his badge, James Reddick, Port Sterling PD, 12-year veteran, had crashed. His pressure was gone. The The number on the screen was 54 systolic and dropping. His skin had gone from gray to white. The chest tube drainage bag had turned a dark arterial red. The nurse covering him, a younger woman named Carla, was already at the head of the bed calling for help. "He's bleeding somewhere," Carla said, which was correct and also insufficient. "When did the color change?" Mara asked, reaching past her to check the pupils. "Unequal. Left larger than right." 2 minutes ago. I paged the attending. "Where is he?" "Bay 4. Mara pressed the call button. "Bay 1 needs the attending now. Patient crashing, suspected internal hemorrhage." She didn't wait for acknowledgement. She was already on the other side of the bed, palpating the abdomen. Rigid. More rigid than before. The left lower quadrant bored hard under her fingers. She paged Victor again. He came in 3 minutes later, which felt like 30. He took one look at the monitor and his expression shifted into a kind of professional sharpening she'd seen from good surgeons in bad situations. He examined the patient, pressed the abdomen, read the drainage numbers. "He needs an X-lap," Victor said. "Exploratory laparotomy. He's bleeding internally." He reached for the phone to call the OR. "OR is occupied," Mara said. "Dr. Nguyen is in there with a ruptured AAA that came in 15 minutes ago. Estimated another 40 minutes at minimum." Victor put the phone down. The monitor alarmed again. 48 systolic. "Get me blood," Victor said. 4 units O-neg running now." She'd already ordered them when she walked in. "Push them faster." She pushed them faster. The pressure didn't respond. 44, then 41. The blood was going in, but it wasn't staying anywhere. It was filling whatever space had opened up inside him and pooling there, not circulating. Officer Reddick's eyes, which had been open and tracking, went glassy and fixed somewhere above the overhead lights. "He's going to arrest," Mara said. Victor stood at the bedside with his hands at his sides. She recognized the posture. She had seen it before, in a different place, a different kind of chaos, and she recognized what it meant, even though she had spent 6 years trying to forget the specific texture of that recognition. A competent person hitting the ceiling of what they can process. Not incompetence, overload. The kind of freeze that happens when everything you know how to do has already been done and none of it worked, and the next step is something you've never actually had to do before in exactly this configuration. "Dr. Hale." He didn't respond. "Victor." She never used his first name. He looked at her. "What do you want to do?" The monitor flatlined for 2 seconds, then resumed. Not a true arrest, a sensor artifact, but Victor flinched like it had been real. And something she'd been watching for the last hour shifted, settled, and clarified into something she could name. He was not going to be able to do this. Not tonight. Not with 40 more casualties coming in and the OR occupied and a man bleeding into his abdomen from a wound that needed to be found and closed in the next several minutes, or there would be nothing left to close. She said, "Get me a thoracotomy kit." Victor blinked. "What?" "Emergency thoracotomy. We're not waiting for the OR." She was already moving, pulling gloves tighter, checking the light. "If the source is the descending aorta or a splenic hilar vessel, I can cross-clamp and buy him time. Get Carla on the ultrasound. I need to confirm location before I open." The silence that followed lasted approximately 3 seconds. It felt considerably longer. "You're a nurse," Victor said. "Get me the kit," she said again. "And someone get on the phone to the OR and tell Nguyen we need her the second she's done, not a minute after." Tanner Oakes, who had been standing in the corner with the particular frozen quality of someone watching an accident that hasn't finished happening, moved first. He went for the crash cart, where the thoracotomy kit was stored. Victor watched him go. Watched Mara take the ultrasound probe from Carla and place it over the patient's abdomen with a practiced efficiency that was, she understood, recognizable to anyone who knew what they were looking at. Because the way you hold a probe, the way you angle it, the speed with which you find what you're looking for, all of that carries the signature of how many times you've done it and under what conditions. Victor was watching her with an expression she couldn't fully read. She found it in 11 seconds. Massive free fluid in the left upper quadrant. The spleen was the source, or what was left of it. The ultrasound image was ugly, the organ margins indistinct, the surrounding tissue full of the bright haze that meant blood. Fragmentation injury, just like she'd said. Just like she'd said an hour and a half ago. She didn't say that out loud. Left splenic hilum, she said instead. Tanner, I need you on retraction. Carla, I need suction on my left side, doctor. Hale. She looked at him. He was still standing there, and she could see that something was happening behind his eyes. A reassessment. The particular recalibration of a man who thought he understood a situation and is realizing he understood it incorrectly. I need you to manage his airway. Can you do that? He could do that. Airway management was something he could do. Yes, he said. The word came out quiet. She picked up the scalpel. Oh. What she did in the next 9 minutes was not something that could be taught in a nursing program. The incision was precise and deliberate, the exposure methodical in a way that spoke to muscle memory. Not the muscle memory of a bedside nurse, but something older and harder. She found the splenic pedicle, identified the bleeding vessel, a branch of the splenic artery, torn, pumping, and cross-clamped it with a speed that made Tanner Oakes inhale sharply through his nose. The bleeding slowed. The numbers on the monitor began cautiously to move in the right direction. Pressure's coming up, Carla said. 62 systolic. Mara did not respond. She was focused on the field. There was a secondary bleeder, small but persistent, from a torn mesenteric vessel, and she chased it back to its source with the focused patience of someone who had done this in worse conditions, in less light, with fewer instruments, with people shooting at her. She did not think about that. 70, Carla said. 74? Good, Mara said. Not to anyone. To herself, maybe. To the numbers. Victor Hale maintained the airway. He did it well, actually. His hands were steady on the bag valve mask, his rate appropriate, his pressure consistent. He was watching her work over the patient's head, and she knew it, and she did not look up. The OR called at 11:31. Nguyen was closing, 15 minutes out. Tell her we need her here, Mara said. Patient is temporized, splenic injury, still needs a definitive repair. He cannot go back to zero pressure before she gets here. Copy that, the voice on the phone said. The monitor read 88 systolic, then 91. Then, slowly, 96. Officer James Reddick did not die that night. Not in Bay 1, not under those lights, not while Mara Ellison was standing over him with her hands inside his body, and her attention narrowed down to the single specific task of keeping him alive until someone more permanently qualified could take over. That was all she was doing. That was exactly all she was doing, and she did not allow herself to feel anything else about it. Nguyen arrived at 11:48 and took over without comment, reading the field in 2 seconds flat and positioning herself like she'd been there from the beginning. She glanced at Mara once. The glance lasted a half second and said several things without saying any of them. Mara stepped back, stripped her gloves, threw them in the biohazard bin. When she turned around, Victor Hale was in the doorway. The corridor outside Bay 1 was as close to quiet as Riverview was going to get for the rest of that night. 3 more gurneys had come in while she was in the bay. She could hear the controlled urgency of the intake process down the hall, the specific vocabulary of triage being performed. The mass casualty wave was still building. She had 7 patients in various states of stabilization and no attending surgeon standing beside her who was currently able to function. She looked at Victor. He looked at her. Where did you train? He said. It wasn't quite an accusation. It wasn't quite a question. It sat somewhere between the two in the territory of things people say when they've seen something they can't explain and need to start somewhere. Night shift needs coverage in Bay 3, she said. The femur fracture in 2 is waiting on ortho, but his pressure is stable. Bay 6 is a bilateral tympanic rupture. Low acuity. She can wait. The incoming wave is going to have at least 3 criticals based on what I heard from dispatch. Victor didn't move. I asked you a question, he said. I heard you. Those techniques... He stopped, started again. What you just did in there is not a procedure they teach nurses. Not anywhere. She met his eyes. Bay 3, Dr. Hale. Mara, I am aware that we will need to have a conversation. Her voice was even, not cold, just contained, in the way of someone who has learned to carry things in a space that doesn't show. That conversation can happen after the department isn't receiving 50 bombing casualties. Right now I need you functional, and I need you in Bay 3, and I need the 3 incoming criticals to have a physician standing next to them when they come through those doors. Can you give me that?" A long silence. Victor Hale, Chief of Trauma at Riverview Medical Center, graduate of 3 prestigious programs and holder of more commendations than the lobby wall could comfortably display, looked at a night shift nurse in a blood-stained scrub top and said, very quietly, "Yes." "Thank you," she said, and she meant it simply, without irony, without satisfaction. It wasn't a victory. It was just what needed to happen next. She turned toward the incoming gurneys. Down the hall, through the automatic doors that hadn't fully closed between arrivals in over an hour, the first of the critical wave was coming in. She could hear the paramedics' voices rising over the sound of wheels on linoleum, could hear the particular urgency that meant they'd been working this patient since the scene, and it hadn't been enough. She picked up the pace. She did not run. Running in a trauma corridor panics the patients who are still conscious. She moved fast and direct and deliberate, and the staff stepped out of her path without being asked to, which was a thing she registered somewhere peripheral and set aside. Bay 7. Young woman, early 20s, blast injury to the thorax, right lung sounds absent, trachea deviated to the left. The paramedic's voice was going, but Mara was already reading the picture. Tension pneumothorax, mirror image of what she'd seen in Reddick, the body's emergency restructuring of its own pressure in the face of a lung that had stopped being a lung. 14-gauge needle, second intercostal space, mid-clavicular, she said to the tech beside her. Then she did it herself because the tech's hands were shaking. The rush of air was audible. The trachea came back toward center. "BP?" she asked. 60 over palp, the paramedic said. "Start 2 large-bore IVs. Run the first leader wide open. She needs a chest tube and she needs a surgeon." She looked over her shoulder. "Where's Doctor? Hale?" "Bay 3, someone said. "Get him here when he's done." She was already managing the tube setup. "And I need the charge nurse. Tell Deborah I need a board. I need someone tracking all active patients in real time, and I need the incoming dispatch channel on speaker in the corridor so I know what's coming before it comes through the door." Behind her, someone was writing things down. She didn't look to see who. The young woman in Bay 7 had blue eyes that were open and frightened and fixed on the ceiling. Mara leaned into her line of sight. "You're at Riverview," she said. "We have you. Stay with me." The eyes tracked to hers. Held. "Stay with me," Mara said again, and turned back to the tube. At 12:19 a.m., Dr. Patricia Garland, Riverview's Chief of Surgical Services, arrived on the floor. She had driven in from a dinner she'd left in the middle, still in the blazer she'd been wearing, stethoscope around her neck, expression calibrated into the particular neutrality of someone assessing a disaster they are now responsible for. She stood at the entrance to the main trauma corridor for 20 seconds before she moved. What she saw, 11 active bays, all occupied. A whiteboard in the corridor with patient names, injury codes, and status updates in 2 different handwriting styles. 3 surgeons working, 1 junior resident doing intake. And at the center of the corridor, not at a nursing station, not at a chart, a woman in bloody scrubs directing traffic with the specific economy of motion that Garland recognized from 2 decades of high-volume trauma. No wasted words, no repeated instructions, no performing competence for an audience. Just the real thing, in the middle of the night, when everything was on fire. Garland walked toward her. Mara was on the phone with the blood bank when she saw the chief coming. She finished the call. She always finished the call, and turned. "Dr. Garland," she said. "Tell me where we are," Garland said. She told her. 31 patients received, 7 criticals, 4 in surgery, 3 stabilized and awaiting transfer, the rest triaged and being managed. 3 more incoming, ETA 11 minutes. The OR was running 2 active cases and had a 3rd prepped. The blood bank was strained but not out. The biggest gap was attending physician coverage in the next 2 hours. Garland listened without interrupting. When Mara finished, the chief said, "You're the one who opened Reddick." It wasn't a question. "Yes," Mara said. Nguyen said the clamp placement was precise. She paused. She said it was very precise. Mara didn't respond. "Who taught you that?" She looked at Garland. The chief was not like Victor. There was no challenge in the question, No territorial defensiveness. Just a direct woman asking a direct question in the middle of a very bad night, and Mara found, somewhat to her own surprise, that she was tired. Not of the work, of the small, constant performance of being something smaller than she was. "I'll give you a full account," she said, "after this is over. Right now I need you to tell me if you want me running the floor or stepping back to a support role." Garland looked at her for 3 seconds. "Run the floor," she said. From down the hall, the automatic doors swung open again. The paramedics were loud this time, which meant the patient was bad. Mara was already moving. She did not see Victor Hale watching her from the doorway of Bay 3. She did not see the specific expression on his face, something she might have described, had she seen it, as the look of a man who has spent a long time being certain of something and has just discovered the certainty was borrowed. She had no time for that now. She had patience. The patient coming through the doors was a man in his late 30s, construction worker based on the calluses and the steel-toed boot still on his right foot. The left one was gone, along with a significant portion of the ankle above it. The paramedics had tourniqueted it at the scene, and the tourniquet had held, but his pressure was already soft, and his color said he'd been losing slow and steady for longer than the tourniquet could account for. Secondary source. Something else bleeding somewhere the blast had reached before the tourniquets did. "Name?" Mara asked as she moved alongside the gurney. "Don't know," the paramedic said. "No ID recovered." "Bay 8. Tanner, I need you." Tanner Oakes appeared from Bay 5 looking like a man who had aged 4 years in the last 2 hours. He was a good resident. She'd revised that opinion upward 3 times tonight, and he came fast, taking the other side of the gurney without being told twice. She talked him through it as they moved, not because he needed her to narrate, but because in mass casualty situations, thinking out loud kept everyone in the same picture and reduced the chance of 2 people doing the same thing while a third thing went undone. Tourniquets holding distally. Soft pressure suggests a secondary source, probably abdominal. Start with the fast exam while I assess the stump. If there's free fluid, we are not waiting for a surgeon. "Understood," Tanner said. The fast exam took 90 seconds. Tanner was good with the probe. "Small effusion, right upper quadrant," he said. "Not massive, could be hepatic." "Could be. Check the pelvis." He checked. "Clear." "Okay." She had the stump dressing off by then and was examining the wound. Ugly, traumatic amputation with blast tissue damage, extending several centimeters proximal to the injury site, but the tourniquet had done its job. The bleeding here was controlled. Hepatic contusion, probably not surgical. Keep him moving, run fluids. He needs orthopedics to evaluate the stump and a CT if his pressure holds above 80. She looked at Tanner. "You can manage this." He nodded once. It was the nod of someone who wasn't sure, but understood that being sure wasn't one of the options available tonight. She left him to it. At the whiteboard, Deborah was updating statuses in her tight shorthand, markers squeaking against the surface. Garland was on the phone at the nursing station, voice clipped, clearly working through the hospital's administrative chain. 2 more nurses had arrived, called in from home, still in civilian clothes over their scrubs, moving with that particular slightly disoriented energy of people who'd been asleep an hour ago. Mara caught them before they dispersed. "You're Reyes?" she said to the one on the left, reading the name badge. "Yes." "Pediatric experience?" 3 years, yes. Bay 11 has 2 minors, 8 and 11 years old, blast concussive injuries, no surgical emergencies, but they are scared and their parents are not here yet. Will you take them?" Reyes was already moving. "On it." The other nurse, Holbrook, 40-ish, calm expression, she directed to Bay 9, where a woman with bilateral hand lacerations and a fractured wrist was waiting for wound management and was well enough to be frightened and asking questions that no one had stopped to answer. "Sit with her," Mara said. "Tell her what's happening. Hold her hand if she needs it." "That's it?" "That's not a small thing tonight," Mara said, and turned away. At 1:15 a.m., Riverview's supply of O-negative blood hit the threshold that triggered the shortage protocol. Mara heard the page and felt a specific cold settle in her stomach. Not panic, something more controlled than panic, closer to the way a ship's navigator feels when the depth reading comes back lower than expected. She went to the blood bank phone. How many units left? 6. The tech on the other end sounded young and frightened. We've got type specific for most of the actives, but 3 of our criticals are still untyped. Reddick is typed? Yes, B positive, we have supply. The woman in 7? A negative. We have 4 units left of A negative. Hold 2 of them for her. Release 2 to whatever surgical case needs them most urgently. She was doing the math in real time, which was the only kind of math that mattered right now. Call Westbrook Regional. They're 40 minutes out, but they have a regional blood depot. Request an emergency transfer of ON neg. Use the mass casualty code. They have to respond. I'm not sure I have authority to. Tell them Dr. Garland authorizes it. She does. I'll confirm with her in 2 minutes. She confirmed with Garland in 90 seconds. Garland didn't ask how Mara knew about Westbrook's regional depot, or why she'd thought to call a hospital 40 minutes away instead of the closer options. She just said, "Good call," and went back to her phone. That was the thing about working in real crisis Mara had learned a long time ago. Not a simulated one, not a drill, but an actual sustained emergency where the resources were actually finite and the decisions actually mattered. In that environment, questions about credentials and hierarchy tended to dissolve under the pressure of simpler questions. Is this person effective? Is what they're saying accurate? Is following their direction going to help or hurt? The staff on the floor tonight had reached that point somewhere around midnight. She couldn't identify the exact moment. It had happened incrementally, decision by decision, as the people around her recalibrated their understanding of who she was relative to what they'd assumed. The newer nurses still sometimes looked to Deborah or to one of the attendings before acting on Mara's direction. But the paramedics coming through the doors had stopped addressing their handoffs to the physicians waiting in the bays and started addressing them to her, which was the most pragmatic measure of authority she knew. They talked to whoever was clearly running the room. She was clearly running the room. Victor Hale was doing good work in Bay 3. She passed by twice and watched through the glass. Steady hands, correct decisions, a 46-year-old woman with a serious pelvic fracture being managed well within his competence. He wasn't shutting down. Whatever had happened to him earlier tonight, the freeze, the backing away, the moment she'd been trying not to analyze, whatever that had been, it hadn't broken him. He was functioning. She was grateful for that in the way she was grateful for any resource that was operational. She did not trust it to hold indefinitely. The conversation she'd been avoiding caught up with her at 1:38 a.m., during a 12-minute gap between criticals when the floor's acuity dropped just enough that she could stand still for 2 minutes without something requiring her immediate attention. She was in the supply corridor, splashing water on her face over the utility sink when she heard the footsteps. She didn't turn around. "I called a colleague at Port Sterling General," Victor said from behind her. "While you were in Bay 7, he was on their trauma staff 6 years ago." She turned off the tap, reached for paper towels. "He says they had a nurse by that name, Mara Ellison. Hired about 5.5 years ago, no unusual background on record." He paused. "Before that, nothing. No employment history, no professional licensing record, nothing. It's like you didn't exist before you showed up at this hospital." She dried her hands, turned around. Victor was leaning against the doorframe with his arms crossed, and he looked, not angry, exactly, unsettled in a way that had curdled into something more aggressive than it deserved to be. He was a man who liked to understand the rooms he walked into, and he had been in a room with her for 3 years without understanding it, and tonight he'd found out what that ignorance had been costing him. "You want to do this now," she said. Not a question, noting a fact. "I want to know who I've been working with." "You've been working with a nurse who has done her job every shift for 3 years. She was tired. Not the physical kind, she was tired. She was past feeling that, but a different kind. The kind that came from spending years inside a smaller version of yourself because the larger version was too much trouble to explain. What happened in Bay 1 tonight was an emergency. I made a call. The patient survived." "That's not what I'm asking." "I know what you're asking." She looked at him steadily. "And I'm telling you that the answer is not something I'm going to give you in a supply corridor at 1 in the morning during a mass casualty event. So you have 2 choices. You can go back to Bay 3 and keep doing the good work you were doing, or you can keep standing there, and I'll go find someone else to cover the floor." Something moved across his face. She'd expected resistance. She got, instead, a long moment of quiet, and then he said, "You knew about the splenic laceration an hour before it happened. You said it in the bay, and I told you to stay in your lane." Yes. If I'd listened, he might have gotten to surgery earlier. She wasn't going to soften it. That's possible. Victor was quiet for another moment. How many times have I done that? Said that to you? She didn't answer because the number wasn't a number she'd kept track of specifically, but she remembered the accumulation of it, the way small dismissals layered over time like sediment, each one individually light and collectively heavy. "Bay 3, she said. "Please." He went. She stood in the supply corridor for 30 more seconds, breathed. Then she went back to the floor. At 2:11 a.m., the situation changed in a way she hadn't anticipated. She was at the nursing station when the hospital's main line rang, and the unit clerk, a young man named Priya, who'd been running communications all night with impressive steadiness, held out the receiver with an expression she couldn't immediately read. "Someone asking for you specifically," he said. "Who?" "He said to tell you it's Colonel Webb, and that he has 2 people incoming who need to see you." The name hit her the way cold water hits. Not painful, but immediate and total. She kept her expression where it was. Took the phone. "This is Ellison." The voice on the other end was exactly as she remembered it. Unhurried, precise, with the particular quality of a man who had never once in his life needed to raise his voice to be heard. "Sergeant Ellison, it's been a while." "I'm not—" She stopped. "What do you need, Colonel?" "I have 2 operatives incoming to your facility. Both are critical. The circumstances around their injuries are classified, which means they cannot be processed through your standard intake. They need direct trauma management, ideally by someone with clearance. You are, as it turns out, the only person at Riverview Medical Center who has that clearance, since you never formally surrendered it." She closed her eyes briefly, opened them. "I left the service 5 years ago." "Your clearance has a 10-year shelf life, Sergeant, and it has 4 years and 7 months remaining. I didn't design that system, but here we are." A brief pause. "ETA is 9 minutes. They'll be brought in through your receiving bay. I need you on those patients personally. I'm managing a mass casualty event. I'm aware. The bombing at Caldwell Station. We believe it is connected to what happened to my people. That's not a coincidence I'm comfortable with, and I suspect you're not either." The words landed with a weight she felt in her chest. She had spent 5.5 years constructing the distance between herself and this kind of conversation, and it had collapsed in a 9-minute timeline. "I'll be at the bay," she said. She handed the phone back to Priya. He looked at her. "Everything okay?" "I need Dr. Garland," she said. She found the chief outside Bay 2 and gave her the short version. 2 incoming critical patients with classified injury circumstances, federal connection, required direct management by cleared personnel. She kept it brief because brevity was the only way to deliver that sentence without it sounding like something out of a story someone was telling. Garland's expression went through several phases in about 4 seconds. "You have federal clearance." "Yes." "As a nurse." "As a former military trauma specialist," Mara said. "I'll explain everything fully after we get through tonight. Right now, I need you to authorize a modified intake for these 2 patients. No standard documentation flagging, treatment records sealed pending federal authorization." "That is a significant administrative—" "I know. I'm asking." Garland looked at her the way she'd looked at the corridor earlier, taking a rapid inventory of what was there versus what she'd expected. "You've been doing exactly what I needed tonight since before I got here," she said. "So I'm going to make a decision based on that. That's all I'm asking. You'll explain everything." "Everything," Mara said. Garland moved toward the administrative office. Mara moved toward the receiving bay. Parsad. The 2 operatives came in on unmarked transport, not ambulances, a pair of black SUVs with law enforcement plates that pulled directly to the bay doors in a way that suggested someone had called ahead to someone Mara hadn't spoken to. The drivers were not paramedics. They were large, quiet men in civilian clothes who moved with military efficiency, and they stepped back the moment Mara and her team took over the gurneys. The first patient was a woman, mid-30s, gunshot wound to the right shoulder, and a second wound to the left flank. The flank wound was the problem. It had been packed at the scene. The packing was saturated, and her pressure was low. Treatable. Mara moved her to Bay 12 and assessed her in under 4 minutes. The shoulder was a pass-through, no significant vascular involvement. The flank wound had clipped the lower pole of the kidney, significant bleeding but not immediately exsanguinating if she moved fast. The second patient was worse. Male, late 40s, blast injury, the same kind she'd been looking at all night, the same fragmentation pattern, the same signature. But whoever had packed his wounds had done it with a skill she recognized. Military-grade hemostatic gauze applied correctly, pressure points correct, airway maintained through a maneuver that wasn't in the civilian first aid manual. Whoever had kept him alive between the scene and this bay knew exactly what they were doing. She looked at the driver who'd been closest to him in transport. "Who rendered initial aid?" The man didn't answer. "The packing is military technique," she said. "I'm not asking for a report. I'm asking because it's going to affect my treatment plan." A pause, then. "His partner. She's the other gurney." She filed that away. The woman had kept this man alive despite being shot twice herself. She would deal with what that meant later, when both of them were stable and she had the space to feel something about it. The male patient needed surgery. She could see that clearly. The fragmentation damage to his right lower chest wall, the compromised breath sounds, the rate at which the saturated gauze was failing to hold. He needed a thoracic surgeon and an OR, and he needed it in fewer minutes than she wanted to count. She was reaching for the bay phone when the doors opened and Victor Hale walked in. She hadn't called him. He must have seen the activity from the corridor. He assessed the scene in the way she'd come to understand he did it. Quick, top to bottom, stopping on the things that mattered, and came to stand beside her without asking permission. "What do you need?" he said. She looked at him. He was still in bloody scrubs, his eyes carrying the specific exhaustion of someone who had been running past their limit for hours, but his hands were steady and his face was clear. Present. Whatever had happened to him earlier tonight, he had worked through some part of it. "This one needs an X-lap and thoracic exploration," she said. "The chest wall fragmentation is compromised. There's likely a pulmonary contusion developing, and I need to know if he has a hemothorax before his pressure drops any further. Or, check with Garland. If there's a suite available, I'll find one." He was already at the phone. "Keep him stable until I have a room." "Working on it," she said. He made the call. She managed the patient, and somewhere in the space between those two things, the specific ordinary efficiency of two people doing adjacent tasks in a high-stakes room, something shifted, not dramatically, not with any kind of announcement, but the way weight redistributes when something has been removed from one side of a scale. She noticed it the way she noticed most things. Filed it, set it aside, kept moving. The OR suite cleared at 2:34 a.m. Victor took the male operative into surgery personally. Mara stayed with the female operative, who was conscious and looked at Mara with eyes that didn't have any fear in them, which was its own kind of information. "You, Ellison?" the woman said. "Yes." "Webb said you'd be here." He was right. She was working as she spoke, hands busy. "Don't talk. Let me get a look at this." "The flank. I see it. Stop talking." The woman stopped talking. The kidney wound was serious but manageable. She worked through the assessment methodically, called a urological consult, got blood running, packed the wound with fresh gauze, and applied correct pressure while the patient's vitals slowly, incrementally, came back to a range that meant not dying right now. It took 31 minutes. At the end of them, the patient's pressure was 94 systolic, and she was watching Mara with an expression that had shifted from assessment to something quieter. "You're good," she said. "Don't compliment me until you're not bleeding," Mara said. The woman almost smiled. At 3:20 a.m., Mara stepped into the corridor to update the board and found Tanner Oakes waiting for her with an expression that told her immediately something had gone sideways. Not a patient. Something else. "What?" she said. "Dr. Hale was in surgery," Tanner said. "But before he went in, about 20 minutes ago, he talked to someone. I don't know who. An administrator, I think. There's a hospital executive here." "Which one?" "Bradford Sims, the COO." Tanner said it carefully, like a man handing over something fragile. He's been in the administrative suite for about 40 minutes. He's asking questions about tonight, about you specifically. She absorbed that without expression. Bradford Sims was someone she knew by reputations. The hospital's chief operating officer, a man whose primary relationship with the clinical staff was adversarial in the particular way of administrators who viewed medicine as a financial function with a patient care byproduct. She had never had a direct conversation with him. She had heard his name most often in the context of complaints she and others had filed that went nowhere, budget decisions that cut staffing to legal minimums, and a disciplinary process that he ran with a rigor that bore an inverse relationship to whether the person being disciplined had institutional power. Asking what specifically, she said. Whether you have clinical authorization to perform surgical procedures, whether you violated your scope of practice, whether the hospital is liable for what you did in Bay 1. Tanner paused. He used the word liability 4 times in the version I heard. She stood with that for a moment. She was tired, genuinely, physically tired in a way she'd been managing around all night. And she was standing in a hospital corridor at 3 in the morning, having just managed 38 trauma patients through a mass casualty event. And somewhere in the administrative suite, a man who had not been present for any of it was building a case. "Thank you for telling me," she said. "What are you going to do?" "Finish my shift," she said. She went back to the board, updated 3 patient statuses, checked on the woman in Bay 12 who was stable and sleeping, checked on the man in Bay 7 who was post-chest tube and whose oxygen saturation was holding at 97, good enough to transfer to the ICU when a bed opened. Checked on Officer Reddick, who had come out of the OR an hour ago and was in recovery, pressure stable, expected to make it. She did not go to the administrative suite. She did not, however, have to go there, because at 3:47 a.m., Bradford Sims came to her. He was a compact man, 60 or so, silver-haired in the way of men who were allowed to age into distinguished rather than old. He wore a suit jacket over dress pants, which meant he'd also come in from somewhere and hadn't had time to change. He had 2 people with him, a woman Mara didn't recognize, and the hospital's risk management director, Frank Calhoun, who she recognized from a meeting 3 years ago at which she had been a silent participant. "Ms. Ellison," Sims said. He didn't offer his hand. "Mr. Sims." She was at the nursing station. She didn't move away from it. "I've been reviewing the events of this evening." He had the tone of someone who had practiced this sentence. Specifically, the events in Bay 1 concerning a patient identified as James Reddick. "I understand you performed an emergency surgical procedure on that patient." "I performed an emergency intervention to control hemorrhage while a qualified surgeon was located," she said. "The patient is alive and in recovery." "That's not," he paused. "That is not the point I'm raising. The point is that you are a registered nurse, not a surgeon, and the procedure you performed is outside the scope of your professional license. It was a life or death intervention in the absence of an available qualified surgeon," she said. "That's addressed under the state's medical emergency exception statute." Sims blinked. He hadn't expected her to cite a statute. "Regardless of the legal interpretation," he said, recovering, "the hospital's protocol requires the hospital's mass casualty protocol activates emergency privileges under Section 4.7 of the Crisis Management Policy," she said, "which Dr. Garland invoked at 2252 tonight. That provision extends emergency clinical authority to the highest qualified available personnel. Dr. Garland placed me in charge of the floor at approximately 23:15. The silence that followed was long enough to be uncomfortable. Frank Calhoun, who was older than Sims and had the look of a man who had spent his career in a room between people who were about to fight, wrote something in his notebook. "Ms. Ellison," Sims said, "I think you need to understand the position you're in." "I understand it," she said. "What I'm wondering is whether you understand the position you're in, Mr. Sims. You are in a hospital that received 51 mass casualty patients tonight. 38 of them were managed through this department. The critical outcomes are significantly better than the statistical expectation for an event of this scale." She kept her voice absolutely level. "If your concern is liability, I'd suggest the liability exposure of having a patient die on a table while the attending surgeon froze, is considerably greater than the exposure of the intervention that prevented that outcome. The woman she didn't recognize was writing something on a tablet. Sims said, "Who told you?" "It's on the record," she said. "The bay has cameras. The monitors log everything. The nursing notes are documented in real time." She met his eyes. "I documented everything tonight, Mr. Sims. Every decision, every intervention, every instruction, time-stamped. Because that's what I do. Every shift." Sims was quiet for a moment. He looked like a man who had walked into a conversation expecting to be the most prepared person in it and had discovered he was not. "We'll continue this discussion in the morning," he said. "I'll be here," she said. He left. She turned back to the nursing station. Her hands, she noticed distantly, were perfectly steady. Priya was watching her from across the desk. "That was," he started. "He'll be back," she said. "With more people." "What are you going to do?" She looked at the whiteboard. 41 patients now tracked, statuses updating, the quiet, competent machinery of a department beginning, slowly, incrementally, to find its footing on the other side of the worst night it had seen in years. "Keep working," she said. At 4:02 a.m., her pager went off. Not a patient code. A message from an extension she didn't recognize, with a text readout that said only, "Need to speak with you. Command level. My people found something." Webb. She stood at the nursing station and read the message twice. The bombing at Caldwell Station. 2 federal operatives with classified injuries. A COO building a case against her in the administrative suite. And now Colonel Webb, who she had not spoken to in 5 years, who had called her sergeant on the phone like no time had passed at all, who said connected like he already knew the shape of something she didn't. She typed back, "Bay 12 family room, 10 minutes. She told Deborah she needed 12 minutes. Deborah, who had watched her run this floor for 6 hours without stopping, said, "Take 15. I have it." She walked toward Bay 12. Down the corridor behind her, unnoticed in the controlled exhaustion of the post-surge department, a door opened in the administrative suite. Bradford Sims stepped out. He was on his phone. His voice was low, but the corridor carried sound at 4 a.m. in ways it didn't at other hours, and the 3 words she caught before she turned the corner were enough to make her steps slow, just slightly, for a moment. Her records don't, and then she was around the corner, and the door closed, and whatever Bradford Sims was saying to whoever he was saying it to was out of her range. She kept walking. The Bay 12 family room was a small space. 4 chairs, a low table, a window that looked out on the parking structure. It smelled like the particular institutional cleanser that hospitals used in rooms where people had cried, a smell that had never stopped being specific to her. She turned the light on low and stood by the window rather than sitting, because sitting felt like the wrong configuration for this conversation. Webb arrived in 8 minutes, which meant he had been closer than he'd indicated. He was in civilian clothes, dark jacket, no insignia, but he moved through a hospital the way military people always moved through civilian spaces, assessing exits, tracking motion in peripheral vision, taking up the position in the room that faced the door. He was 55 now, or close to it, and he looked it in the face, but not in the way he carried himself. He looked at her the way people look at something they thought they'd left behind and are surprised to find still intact. "You look tired," he said. "I've been working since noon yesterday. 51 patients. 52 as of an hour ago." She crossed her arms. Not defensively. It was cold in the small room, and the adrenaline that had been keeping her warm for 7 hours was starting to ebb. "What did you find?" He sat in one of the chairs, not because he was relaxed, she knew the difference, but because sitting was a deliberate choice to make the conversation feel less like a briefing. "The Caldwell Station bombing wasn't random," he said. "The device placement was tactical. 3 separate charges configured to maximize casualties in the central concourse while leaving the perimeter exits clear." She looked at him. "Why clear the exits?" "Because the target wasn't in the concourse." He met her eyes. The primary target was the Transit Authority security office on the mezzanine level. It was evacuated 12 minutes before the detonation, which means someone with access to the building's security communication system pulled the personnel out before the device went off. She let the implications of that arrange themselves. Someone had emptied the room they actually wanted empty, then detonated in the public concourse to create chaos large enough to obscure the operation. 52 civilian casualties as a distraction. She'd spent the last 7 hours treating the distraction. "What was in the security office?" she said. "Surveillance data. 3 months of footage from Caldwell Station's camera network. Footage that my people had spent 11 weeks acquiring access to through a separate operation." He paused. "The footage is gone. The office was entered between the first detonation and the arrival of emergency services. The servers were physically removed. And your 2 operatives were running interdiction on the extraction team." He said it simply, without drama. "They arrived late. The data was already gone. My people were identified and engaged." He looked at the table for a moment. The woman kept him alive. She took 2 rounds doing it. She did. Mara thought of the female operative's expression in Bay 12. No fear, just the particular steadiness of someone operating at the edge of what their body could do. "She's stable. The kidney will need follow-up, but she'll keep it." Good. And she could hear that it was genuinely good to him, not administratively good. "The man is in surgery." "Dr. Hale is good," she said. "He'll be fine." Webb nodded. Then he leaned forward slightly. The surveillance data those servers contained. It was footage of a meeting, recurring meetings over the course of several weeks. Individuals connected to a network we've been tracking for 2 years. One of those individuals is connected to your hospital. The room went quiet in a way that rooms don't usually go quiet. Not an absence of sound, but a specific quality of attention that felt like pressure. "Connected how?" she said. "Financially. A series of payments routed through a medical consulting LLC to an account we traced 18 months ago. The LLC is a shell. The beneficial owner, after 4 layers of corporate structure, is someone with a direct administrative relationship to Riverview Medical Center." She thought of Bradford Sims at 3:47 in the morning, on his phone, 3 words carried by an empty corridor. Her records don't. "How long have you known about the connection to this hospital?" she said. 6 weeks? Webb watched her face. "The reason I called tonight wasn't only because my people needed cleared trauma management. It was also because you work here, and because I know your record, and because I needed someone on the inside of this facility who I could trust to tell me if anything tonight looked wrong. You could have called me 6 weeks ago." "You left the service," he said. Not an accusation, just a fact, with the particular flatness of facts that have weight behind them. I respected that. I'm not respecting it anymore because someone just killed 52 people, hurt them. Most of them are alive, but the intent was for worse, and the thread leads back to a building where you work. That makes it your problem whether you want it to be or not. She looked out the window. The parking structure was mostly empty. A few vehicles in the emergency staff section, the overhead lights casting orange pools on the concrete. Somewhere behind her, the hospital was still running. Monitors, conversations, the machinery of acute medicine continuing regardless of what was happening in a small family room on the east wing. "Bradford Sims," she said. Webb's expression didn't change, which was its own answer. "He came to see me at 4 this morning," she said, "building a scope of practice case. Liability." She turned back to face him. "Is that possibly coincidental?" Webb said. "Possibly not. The meeting footage would have been bad for him. If he knew we were close to recovering it, and if he has connections to the extraction operation, then removing the footage and simultaneously moving to discredit a potential witness in the building, that's not a complicated play. I'm not a witness to anything." "You are now," he said. "You've been in this building all night, 52 patients, federal operatives with classified injuries, and he came to see you personally at 4 a.m. She sat down. She didn't plan to. Her body made the decision before she did, some accumulated weight finally finding its way to her legs. She sat in the chair across from him and looked at her hands for a moment. They were steady. They were always steady when it mattered, which was a thing she was sometimes grateful for and sometimes found unnerving. "What do you need from me?" she said. "Right now? Nothing. Stay on the floor. Do your job." He reached into his jacket and placed a card on the table. Plain, just a number. "That line routes to my operations coordinator. If Sims makes another move, if anything in this building looks wrong, if someone asks you questions they shouldn't know to ask, you call. She picked up the card. And if I don't want to be back in this, then don't call. He stood. But I think you already know you're already in it, Sergeant. She didn't correct him this time. She came back to the floor at 4:28 a.m. to find three things had changed while she was gone. First, Victor was out of surgery. His patient, the male operative, who she still didn't have a name for, was in the ICU, pressure stable, breathing on his own. Victor was in the corridor outside the OR suite, mask around his neck, scrub cap in his hand, looking at nothing with the expression of a man who has been inside something difficult and is now trying to locate himself in the ordinary world. Second, Tanner Oakes had flagged something in the medication dispensing records. A discrepancy in the controlled substance log for the overnight period, 2 doses of an IV sedative documented as administered to a patient in Bay 6, a patient whose chart showed no order for that sedative, who in fact had been discharged to the waiting area 2 hours before the doses were supposedly given. It was the kind of discrepancy that could be a charting error. It was also the kind that could be something else. Third, Bradford Sims had requested the Bay 1 security footage from the hospital's IT security manager. Deborah told her all three in the space of 90 seconds at the nursing station. The way Deborah delivered information, efficiently, without editorializing, watching Mara's face for signals. Mara processed them in order of operational urgency. Victor first. He was standing right there, and she needed to know his state. She walked to him. "How is he?" she asked. "Alive," Victor said. The chest wall damage was more extensive than the imaging suggested. There were 3 distinct fragment tracks. "I had to take a section of the 5th rib." He exhaled. "It went okay." "Good." He looked at her. He was exhausted in a bone-deep way, the kind of tired that made the architecture of a person's face visible, the actual structure under the professional surface. "I need to ask you something," he said. "Yes?" "When you were in Bay 1, earlier tonight, before I arrived," he turned the scrub cap in his hands. "Did you know I was going to freeze?" She thought about lying. Not a serious thought, just the reflexive moment of consideration. "No," she said. "I knew the situation was going to exceed the resources available. I didn't know specifically what would happen." "But you weren't surprised." She didn't answer, which was an answer. He nodded slowly. "I've been thinking about the number of times I told you to stay in your lane. Over 3 years. He stopped, started again. "You never pushed back, you just kept doing what you were doing more than you were supposed to." "I pushed back when it mattered," she said. "The splenic laceration, I said it clearly." "And I ignored it." "Yes." He absorbed that without flinching, which was the most she could ask of him at 4:30 in the morning after a night like this one. "The medication discrepancy Oakes flagged," he said, shifting. "I saw the note. That's not a charting error." "No," she agreed. "It's not." She went to Tanner next. He was at the secondary workstation with the dispensing record pulled up on the screen, a printout beside it, the specific doses highlighted in yellow. "Walk me through it," she said. He did. Midazolam, 2 milligrams IV, documented at 114 and 147, attributed to a patient in Bay 6. The patient in question had been a 43-year-old woman with blast-related hearing damage and superficial lacerations, fully conscious, ambulatory, transferred to the waiting area before midnight. No sedative order in her chart. No physician's signature on the dispensing log entries. "Who pulled the medication?" Mara asked. "The log shows a credential access under the name Holbrook," Tanner said carefully. Holbrook. The nurse she'd directed to Bay 6 hours ago. The one she'd told to sit with a frightened patient and hold her hand. She kept her face neutral. "When did Holbrook come in tonight?" "Called in around midnight, same as Reyes." "And where is she now?" Tanner looked around the floor. "I haven't seen her in about 40 minutes. Mara went to the medication dispensing unit and checked the physical log. The cabinet for controlled substances required a biometric scan in addition to credential entry. She pulled the biometric access record, which was a secondary system and didn't always get cross-referenced during a busy shift. The scans at 114 and 147 were there. The biometric identifier matched Holbrook's employee record. 2 milligrams of midazolam, twice, to no patient, in the middle of a mass casualty event when no one was looking at the controlled substance cabinet. She stood at the dispensing unit for a moment, very still. Midazolam. IV-grade benzodiazepine sedative. In a hospital context, sedation, anxiety management, procedural use. In the context she was now thinking in, the same drug class used in targeted incapacitation. The kind of thing someone might use if they needed to slow a specific process, compromise a specific person's function, or if the dose were wrong or repeated or given to someone with contraindications, cause a clinical event that would look, in the chaos of a mass casualty night, like a complication. She looked at the timestamp, 1:14. She thought about who had been critical at that hour, who had been in a bay unmonitored, who had Officer Reddick. Bay 1 verschwommt. He'd crashed at 1:04. She moved fast to the ICU, not running. She never ran in the corridors, but moving with a speed that made the night shift tech step aside without question. Reddick's nurse was a woman named Sue, who'd been managing him post-surgery with the careful attention of someone who understood he was the night's most complex outcome. Mara pulled his chart at the nursing station. His post-op talk screen, she said. Was one ordered? Sue looked surprised. Standard post-surgical, yes. Blood was drawn at 2:15. Is it resulted? Should be. Let me check. She pulled it up, scanned. Her expression changed. What? Mara said. Midazolam detected, Sue said slowly. 0.4 micrograms per milliliter. The anesthesia record shows 0.15 on induction. The remainder is unaccounted for. The numbers, the timestamps, the dispensing log. The crash at 1:04. Not a natural deterioration, not a complication of his injuries, but an acceleration. Someone had given James Reddick enough midazolam to drop his already compromised cardiovascular function into crisis. Not enough to kill him outright, enough to push a man who was already at the edge over it, enough to make it look like he'd simply been too far gone to save. She had saved him anyway, without knowing someone had tried to make sure he couldn't be saved. She stood at the ICU nursing station with the talk screen in her hand, and the specific quality of cold clarity that came when a picture stopped being abstract and became something concrete and close. Reddick had seen something, or knew something, or was someone that someone else needed to be dead tonight in the chaos of a mass casualty event that had been, as Webb had said, designed to create exactly that kind of chaos. She needed Webb. She needed Garland. She needed to have a very controlled conversation with hospital security about the location of a nurse named Holbrook, who had left the floor 40 minutes ago, and whose biometric scan was in a medication log in a way that meant she either had an explanation or she didn't. She pulled out Webb's card, and her pager went off. Not a patient code. The administrative extension. Bradford Sims, at 5:12 in the morning, paging her to the executive conference room on the 3rd floor. She looked at the pager, looked at the card, looked at the talk screen results still in her other hand. Then her phone rang. An outside line routed to her through the hospital system, which meant someone had specifically asked to be connected to her directly. She answered. The voice on the other end was not Webb. It was a woman, crisp and flat, with the particular cadence of someone reading from something prepared. Is this Mara Ellison, registered nurse, Riverview Medical Center? Yes. This is Special Agent Dana Rourke, Federal Bureau of Investigation. I'm in the lobby of your facility. I have a warrant to speak with Bradford Sims, and I have a separate request to speak with you regarding the events of tonight. A brief pause. Ms. Ellison, I'm going to ask you not to go anywhere, and not to speak with Mr. Sims before you speak with me. Can you do that? Mara looked at the pager. At the time, 5:13. At the talk screen in her hand. At the number on Webb's card. I'm in the ICU, she said. 3rd floor, come up. Special Agent Dana Rourke was younger than Mara expected. Early 40s, dark hair pulled back without ceremony, a jacket that had been pressed this morning and was less pressed now. She came off the elevator with a second agent, male, who she introduced as Cahill, and she moved through the ICU corridor with the particular efficiency of someone who had been awake as long as Mara had and was not advertising it. She looked at the talk screen in Mara's hand before she said anything else. What is that? She said. Post-surgical toxicology on James Reddick, Port Sterling PD. Mara handed it to her. Midazolam level inconsistent with anesthesia records. The excess correlates with a controlled substance dispensing log irregularity I found 40 minutes ago. Rourke read it, handed it to Cahill without looking at him. You found this on your own. I found the dispensing discrepancy. The talk screen was already resulted. Nobody had cross-referenced it because nobody was looking for it. Why were you looking for it? Because a nurse named Holbrook pulled the medication, documented it to a patient who'd been discharged, and has been missing from the floor for the last hour. She kept her voice measured. And because the timing of Officer Reddick's crash corresponds with the administration window. Rourke was quiet for a moment. Not processing, she was already past processing. She was deciding. Where's Reddick now? Room 14, ICU, stable. His nurse is Sue Park. Is he conscious? Intermittently. He was sedated for surgery. He's coming out of it. We need to speak with him when he's able. Rourke looked at Cahill again. Get Sue Park. Make sure nobody enters that room without one of us present. Cahill moved. She turned back to Mara. Bradford Sims, you said he paged you at 5:12. To the executive conference room on 3. Don't go. We have a warrant for his financial records and his communications, and we have a parallel warrant for the hospital's security footage from tonight. When we execute those, we'd like the floor to be as stable as possible. She paused. Which means I'd like you on the floor and not in a conference room with him, where he can say anything he wants without a witness we trust. A witness we trust. The phrase arrived with a specific weight. Mara had spent the better part of this night being treated as something between an obstacle and a liability by the people with institutional authority in this building. And here was a federal agent she'd met 4 minutes ago using the word trust like it was a settled matter. You spoke with Webb, Mara said. An hour ago. No apology in it, no explanation. Just a confirmation. He speaks highly of your judgment. He could have called me 6 weeks ago. He could have, Rourke said. That's a conversation for another time. Right now I need to know, the 2 federal operatives you received tonight, are they secure? The woman is in Bay 12, guarded by her own transport team. The man is in the ICU, room 9. Victor Hale performed his surgery. Hale. She said the name with the cadence of someone checking it against a list. The attending surgeon. Chief of Trauma, Mara said. And then, because Rourke had the quality of a person who made better decisions with more information. He had a difficult night. He's functional now. His surgical work on the male operative was good. Rourke accepted that without comment. I'm going to need you to walk me through the full timeline of tonight, she said. Starting from the first casualty arrival. Can you do that? I documented everything in real time. I know. I want to hear it from you, Sep. They did it in the ICU family room, the same small space where Webb had sat across from her an hour ago, which now felt like a different era. Mara talked. Rourke listened and occasionally wrote something down, but mostly just listened, with a specific quality of attention that meant she was mapping rather than recording, building a structural picture of the night, how things had connected, what had been visible to whom and when. Mara told it in order. The first casualty at 9:47, the tension pneumothorax, Victor's dismissal of her assessment, Reddick's crash, the intervention, the controlled substance log, Holbrook's disappearance. She told it factually, without self-justification, without editorializing Victor's behavior or softening it either. She was aware that Rourke was noting the places where she declined to soften things, and that this was itself a data point. When she finished, Rourke said, Sims came to see you at 3:47 and again paged you at 5:12. In your assessment, what was the goal? The first visit was establishing the scope of practice case. Liability framing, trying to make my intervention in Bay 1 look like a violation rather than an emergency response. She kept her phrasing neutral. The second, I don't know. Either a continuation of that or something else. Something else, Rourke said. If he's connected to the network Webb identified, and if he knew his financial records were potentially accessible through the Caldwell footage, and if he's been monitoring who tonight's key witnesses are, she stopped. What would happen if you went to that conference room alone? Mara looked at her. I'm not suggesting he was going to hurt you, Rourke said. I'm suggesting a coercive conversation with no witnesses, documented afterward as a hospital disciplinary meeting in which significant pressure was applied. Resignation. NDA. The kind of outcome that removes a credible witness from the picture without leaving marks. She'd thought of it abstractly in the corridor outside the administrative suite. She hadn't fully articulated it to herself. Hearing it articulated out loud had the clarifying effect of cold water. I'm not resigning, she said. I know. Rourke closed her notebook. Okay, here's what happens next. Cahill and I execute the warrant on Sims's communications and financial records within the hour. Simultaneously, our digital forensics team accesses the security footage. All of it, the entire night, all bays. That footage includes Bay 1. She held Mara's eyes. Everything that happened in that bay tonight is on record. Including what Victor Hale did. Including what he did and what you did, and the sequence and timing of both. She stood. We're not building a case against you, Ms. Ellison. We're building a case against the people who used a civilian bombing as cover for an intelligence operation and then tried to ensure the officer most likely to have witnessed their prior activity didn't survive the night. She picked up her jacket from the chair back. You kept him alive. That's going to matter. Mara stood. Her body registered the motion as an effort in a way it hadn't earlier in the night. The accumulated weight of 8 hours finally making itself known below the adrenaline line. One more thing, Rourke said at the door. Holbrook. You said she's been missing from the floor for an hour. We need to find her before she leaves the building. Is there anyone on the floor you trust to help with that quietly, without alerting Sims's office? Mara thought for exactly 2 seconds. Deborah Wills, charge nurse. She's been running the communications board all night. Will she work with us? Tell her I asked her to, Mara said. She'll work with you. She went back to the floor. It was approaching 5:30, and the department had moved past the acute phase of the night into something more like the aftermath, patients in stable configurations, the incoming wave absorbed, the machinery of ongoing care replacing the machinery of crisis. The corridor was quieter. The whiteboard had more green status markers than red ones. Deborah was at the nursing station looking like a person who had held something together through sheer force of organizational will and was now running on the residue of it. Mark came to stand beside her at the board. Cahill, she said quietly, using the name of Rourke's partner. FBI, he'll come to you in the next few minutes. He needs help locating a staff member. Do what he says. Deborah didn't look surprised. Holbrook. You noticed. She pulled a controlled substance entry at 1:14 and I couldn't find her to verify it at 2 a.m., Deborah said. I flagged it internally. I didn't know who to escalate to. Escalate to Cahill. Mara looked at the board. How are we? Bay 3 and 4 can be stepped down. The 2 and 11 are ready for floor transfer. Reddick's ICU status is likely good for the next 12 hours. Deborah paused. Dr. Hale asked about you. Where is he, Washsam? Attending lounge. He's been there for 20 minutes. He looked like he had something to say. She went to the attending lounge, which was a slightly larger room than the family room, with a coffee maker that was currently producing coffee at a rate that suggested it had been running for several hours. Victor was sitting in one of the chairs with his elbows on his knees and a paper cup he didn't appear to be drinking from. He looked up when she came in. The FBI is here, he said. Yes? They're going to pull the Bay 1 footage. Yes. He turned the cup in his hands. I need you to know that I'm not going to try to shape that narrative. Whatever it shows, I'm not going to contest it or reframe it. He said it with the kind of flatness that meant it had cost something to arrive at. What I did in that bay tonight, what I didn't do, that's on the record, and it should be. She sat down across from him. She was tired enough that the chair felt like a decision. Why are you telling me this? She said. Because Sims came to me before he came to you, Victor said. At around 3:15. He told me there was going to be a review of tonight's events. He specifically asked me what I had observed regarding your conduct. He paused. He implied that if I supported his scope of practice position, my own conduct tonight would be handled internally, quietly. She looked at him. I told him I needed to review the situation before commenting, Victor said, which was the most cowardly phrasing I've ever used in a professional context. He stopped. I've been sitting here for 20 minutes because I needed to say that to you before the FBI pulled the footage, and the whole thing became part of a record. I didn't support him. I also didn't refuse him clearly enough. I want you to know that. She thought about the supply corridor at 1:30 in the morning when she'd sent him back to Bay 3 and been briefly, privately grateful that he'd gone without argument. She thought about the woman in Bay 7 whose trachea she'd decompressed while he was managing a patient he could handle. She thought about 3 years of stay in your lane spoken in various registers of dismissal. She thought about what it cost a man like Victor Hale to sit in a chair at 5:30 in the morning and say what he'd just said. What did you tell Sims when he suggested your conduct could be handled quietly? She said. Nothing useful. He looked at his cup. But I'm going to the FBI after this and telling them what he said to me. That would be helpful, she said. And then, thank you. He looked up. The thanks seemed to land somewhere he hadn't expected. I need more coffee, he said. Can I get you outside? No, she said. I need to get back to the floor. At 6:04 a.m., Bradford Sims was located in the executive conference room on the 3rd floor by agents Rourke and Cahill. He was not alone. His attorney, who had apparently been called somewhere around 4 a.m., was present via phone. The warrant execution was quiet, efficient, and according to Cahill's brief update to Mara at the nursing station, Sims had responded to the presentation of the warrant with 4 seconds of total stillness and then a very careful statement about his willingness to cooperate, delivered in the tone of a man who understood that his options had just contracted significantly. His phone and laptop were taken. His email access was suspended. His keycard was flagged to prevent access to the server rooms and the security system terminal. He was not arrested, not yet. But the particular quality of not yet was visible in the way Cahill said it. At 6:31, Holbrook was found. She was in the staff parking structure, in her car, engine running, with a bag in the back seat that a brief visual inspection suggested was packed. She had not left the premises because the parking structure's exit gate required a staff card swipe to release after midnight, and her card had been quietly flagged by Deborah at Cahill's request 2 hours ago. She had been sitting in a running car in a parking structure for 2 hours, which spoke to either a failure of planning or a catastrophic hope that the situation would resolve itself before she had to drive anywhere. It had not resolved itself. She came with Cahill without resistance. This was how Mara heard it from Deborah, who heard it from the security officer who watched the parking structure cameras. No drama. Just a woman getting out of a car, leaving the engine running, and walking beside a federal agent because the alternative options had all closed. Rourke came to the nursing station at 6:47 to update Mara directly. Holbrook is in custody, cooperating. She said it at a register that didn't carry past Mara's immediate vicinity. Sims's financial records are confirming the connection Webb identified. We're looking at payments dating back 19 months, routed through the consulting LLC to Sims, and separate payments to a third party we believe retained Holbrook as a contact. She was placed on the hospital's on-call list 8 months ago. Placed, Mara said. Not hired through normal channels? Her HR file is clean, Rourke said. Someone with access to the hospital's administrative system seeded it. We're working backward through who made those entries. She paused. It's consistent with Sims's access level. Mara absorbed that. 8 months. Holbrook had been here for 8 months, waiting, on call, building a cover that blended into the background of a busy hospital exactly the way background is supposed to blend. Tonight had activated her. The mass casualty event, the cover, the distraction, the chaos, had been the signal, and Holbrook had used it to access a medication she had no reason to access and give it to a patient she had no reason to approach. Why Reddick? Mara asked. Specifically, Rourke's expression shifted, not quite something she could name, somewhere between clinical and careful. Officer Reddick was the lead investigator on a Port Sterling PD inquiry into transit authority contracting irregularities. The inquiry opened 4 months ago. He'd subpoenaed records from 3 companies, all of which, we now believe, have ownership ties to the same network we've been tracking. She let that sit. He was at Caldwell Station tonight because the inquiry had connected to the Transit Authority's security office. He was there to meet a source. The source had presumably not been available to meet him. The source had been in the security office when it was cleared, or was the one who cleared it. He doesn't know any of this, Mara said. No, he's been unconscious. Rourke paused. When he's ready to speak, we'll need to be there. I know. She looked at the ICU corridor. His pressure has been stable for 3 hours. He was responding to verbal stimuli at last assessment. She paused. Give Sue an hour to bring him up properly. Don't rush it. We won't rush it. Rourke looked at her with an expression that had something in it she wasn't quite ready to call respect, but was adjacent to it. You've been awake for how long? Since noon yesterday. That's too long. I'm aware. Is there anyone who can cover the floor? Dr. Garland has been here since 1. She has attending coverage arriving at 7. Mara looked at the clock, 6:52. 8 minutes. After 7, Rourke said, I'd like you to go somewhere and sleep. We'll need a full statement from you, but that can wait until you're functional. I'm functional. You've been functional for 18 hours, Rourke said. That's different. The day shift attending arrived at 7:03. Dr. Sandra Veit, a compact woman with short gray hair who took one look at the whiteboard, the patient's census, and the particular quality of controlled exhaustion on every face around her, and understood, without anyone explaining it, that the night had been significant. She came directly to Mara at the nursing station. Status, she said. Mara gave her the full handoff. 43 patients currently in system, 7 in ICU, 3 post-surgical and stable, the rest distributed through the department at varying acuity levels. The pediatric cases ready for floor transfer, the pelvic fracture in 3 that would need orthopedic follow-up this morning. Reddick's situation she described as ongoing police investigation, federal involvement, restricted access. Veit listened the way experienced clinicians listened, processing and prioritizing simultaneously, not waiting for the end to begin sorting. When Mara finished, Veit said, You ran the floor. Yes. Overnight, mass casualty. With the attending, she stopped. Victor is still here? He's in the attending lounge. Veit's expression was unreadable in the way of long-experienced colleagues who have opinions about specific people and have learned to keep those opinions in a particular location. I'll speak with him. She looked at Mara. Go eat something. I have this. Mara did not go eat something. She went to the ICU. Reddick was in room 14, which had a window that the morning light was beginning to reach at a low angle. He was awake. Not fully, not the alert wakefulness of someone rested, but the provisional wakefulness of a man pulling himself back through layers of sedation with deliberate effort. His color was better. His pressure on the bedside monitor read 112 systolic, which was the best number she'd seen on him since he arrived. Sue was at the charting station just outside. She looked up when Mara approached. He asked for water 20 minutes ago, she said, then went back under. He's surfacing again. Is Rourke's team positioned? Agent outside the door since 5:30. Mara went in. She kept the movement quiet. No rushing, no clinical briskness. She came to the bedside and checked his monitor, then his IV lines, then his dressing. The surgical site was dry, no bleed-through, the drain output within acceptable range. She checked his pupils. Equal, reactive, responding appropriately to the pen light. She turned the light off. His eyes opened. They were brown, she registered, a detail she hadn't had time to register in Bay 1. He was looking at her with the particular unfocused determination of a person trying to establish where they are and what they survived. You're in the ICU at Riverview Medical Center, she said, keeping her voice even and low. You were brought in last night with injuries from the Caldwell Station bombing. You had emergency surgery. You're stable. He worked through that. She could see it. The slow, sequential processing of a man whose brain was rebooting through a sedative haze. Then he said, The surgery. A splenic injury, it was addressed. You'll have a scar and a follow-up schedule, but the damage is controlled. He looked at the ceiling for a moment. Then, quietly, Who did the surgery? I stabilized you. Dr. Hale completed the repair. He turned his head to look at her, the effort visible. You're the nurse. Yes. Something in his face that might have been an attempt at a wry expression if he'd had the energy for it. You grabbed a scalpel, he said. Yes. In the ER? Yes. He was quiet for a moment. The source I was meeting at Caldwell, he said. Did they? Don't worry about that right now, she said. There are federal agents who need to speak with you when you're ready. They'll answer what they can. Federal. He processed that. FBI. Yes. His eyes moved to the window, to the low morning light. He was thinking. She could see that even through the sedation residue, the specific look of a man whose investigative mind had not fully switched off despite everything his body had been through. The midazolam, he said. She went still. He looked back at her. I wasn't out when they gave it, he said. His voice was rough, each word taking effort. I was not far enough out. I felt the second dose. I couldn't. He stopped, breathed. I couldn't do anything about it. I couldn't even open my eyes. He paused. I heard someone leave the bay. She held herself very still. Can you describe the voice or anything you heard? Female, he said. She didn't say anything, just movement, the IV line, then gone. He looked at her. Someone tried to kill me. We know, she said. We're working on it. He absorbed that. The person you're working on, how high does it go? She thought of Sims's face at 4 a.m. She thought of Webb's voice on the phone. Connected to your hospital. She thought of 18 months of payments and a nurse seeded into an HR file and a bombing designed to create exactly enough chaos to hide exactly one targeted murder inside it. High enough, she said. Get some rest. The agents will come to you when you're ready. She was at the door when he said, Thank you. Not the reflexive version, the version that meant something specific about a specific thing. She looked back at him. You kept me here, he said. She didn't answer that because there wasn't an answer she was going to say out loud that wouldn't sound like something she didn't mean. She nodded once and went back into the corridor. At 8:15 a.m., Rourke convened what she described as an informal briefing in Garland's office. Informal meaning no recording equipment, no formal case structure, but everyone present was aware that what was said would be part of subsequent documentation. Present. Rourke, Cahill, Garland, Mara, and somewhat to Mara's surprise, Victor Hale, who had not been asked to leave and had apparently asked to stay. Rourke laid it out with the particular economy of someone who knew the full picture and was choosing the portions appropriate for this audience. The financial connection between Sims and the network Webb's operation had identified. The Caldwell station bombing as cover for the server extraction. Holbrook's placement and activation. The attempt on Reddick's life and his survival due to, here Rourke looked at Mara without editorializing, circumstances the network had not anticipated. Garland listened with the expression of a person receiving information they had suspected in outline and are now hearing confirmed in specifics. When Rourke finished, Garland said, Bradford Sims has been with this hospital for 11 years. We know, Rourke said. The board will need to be notified. We'll handle that notification through our office. There's a specific sequence we need to follow to prevent any record destruction that hasn't already been caught. Rourke paused. His access has been fully suspended as of 6 a.m. His office is sealed pending the warrant. Garland looked at her desk, then at Mara. The scope of practice review he initiated. The case against your intervention in Bay 1. It will be part of the investigation record, Rourke said, along with communications that indicate the review was initiated as a strategy to discredit a witness. She said it matter-of-factly, without satisfaction. In terms of the hospital's internal review, that's your jurisdiction, but the communications make the intent fairly clear. The footage, Victor said. He was sitting at the far end of the office, and he said it without looking up, with the tone of someone completing a sentence they'd been building for a while. The Bay 1 footage. What does it show? Rourke looked at him. Everything. Including my conduct, he said. Yes. He nodded once. I'd like to submit a voluntary statement regarding my actions in Bay 1, before any formal review is initiated. He looked at Garland. I'm not asking for any consideration in exchange. I just want it to be part of the same record. Garland looked at him for a long time. Whatever she saw in his face, she said, I'll arrange it this morning. At 9:03 a.m., Mara was in the supply corridor, the same one where she'd talked to Victor at 1:30, which felt like something that had happened to a person in a different story. Drinking a cup of coffee that had gone lukewarm. She was not thinking about anything specific. She was doing the thing she sometimes did after a sustained high-intensity period, which was simply allowing her mind to be quiet for a few minutes without directing it anywhere. Her phone rang. Webb. "Holbrook is talking," he said when she picked up. "She's been talking for 2 hours. She rolled on the full network. Names, transaction records, communication channels. The extraction team from Caldwell has been identified. Rourke's people are executing 4 additional warrants as of this hour." "Sims," she said. "Formally arrested at 8:50. Fraud, conspiracy, attempted murder for hire, the last one based on the Reddick operation. Holbrook's cooperation makes the charge viable." He paused. He walked out of the hospital in handcuffs. There were staff in the lobby. She thought about that. Bradford Sims in a suit, always, with the particular bearing of institutional authority, walked out in handcuffs. She didn't allow herself to feel satisfaction exactly. Satisfaction was a clean thing. And this was not a clean thing. 52 people hurt at Caldwell Station and a police officer nearly killed in a hospital bed. But she allowed herself to note that the specific weight she'd been carrying since 3:47 in the morning was lighter. "What happens to my clearance?" she said. "That's a conversation for later," Webb said. "After you sleep." "I'm getting that suggestion a lot. Because everyone who looks at you can see that you've been awake for 22 hours. A pause. "You did good work tonight, Sergeant." "Don't call me that." "After tonight," he said, "I think you've earned the right to decide what you want to be called." Another pause, shorter. "Get some sleep." She ended the call. Stood in the supply corridor with the lukewarm coffee for another 2 minutes. Then she rinsed the cup and went back to the floor. The day shift was fully in motion. The overnight team was mostly gone. She could see the particular collective exhale of a department that had made it through something and was now allowing itself to know it had made it through. Vate had the board. Tanner Oakes was writing up his patients for handoff, and she could see in the way he was writing, careful, thorough, with the specific detail of someone who had learned something significant about what detail could mean, that tonight had changed something for him. She was getting her bag from the nursing station when Garland found her. "A moment," the chief said. They stood at the station rather than going somewhere else, because neither of them had the energy for another small room. Garland looked at her with the expression she'd been wearing since 1 in the morning, direct, recalibrating, and not quite done. "I want to say something before you go," Garland said. "You don't need to." "I know I don't. I want to." She straightened slightly. "I've been the chief of surgical services at this hospital for 9 years. In that time, I have made a significant number of decisions about staffing, credentialing, resource allocation, and personnel hierarchy. Most of those decisions were good, some were inadequate." She met Mara's eyes. "Allowing the clinical environment in this department to be one in which your capabilities went unused and went dismissed for 3 years. That was inadequate." Mara didn't say anything. "I'm going to be having a formal conversation with Dr. Hale," Garland continued. "But separate from that, I want to have a different conversation with you about your background, your training, and what this hospital should be offering you rather than requiring you to work under." She paused. "Not today. You need to sleep." "Everyone keeps telling me to sleep," Mara said. "Because you look like you're held together with caffeine and discipline," Garland said, with something that was close to wry. "Go home. Come back when you're human." Mara almost smiled. Not quite. Close. She picked up her bag. At the elevator, she stopped. Deborah was at the nursing station 15 feet away, and Deborah was looking at her, and in Deborah's expression was something Mara hadn't had much occasion to see directed at her in 3 years at this hospital. Uncomplicated, unambiguous acknowledgement. Not gratitude, something simpler and more durable. The look of someone who witnessed something and knew exactly what they witnessed. Mara raised her chin once, the smallest possible acknowledgement. Deborah raised her coffee cup. The elevator opened. She stepped in. The doors closed. In the lobby, the morning shift was arriving. Staff crossed through with coffee cups and ID badges. The ordinary managed flow of an institution beginning its day. Several of them glanced at her, at the dried blood on her scrub top that she'd forgotten was there, at the 12-hour past its end look of a person who'd been working since noon yesterday. One of the cafeteria workers, a broad-shouldered man named Oscar, who had nodded to her most mornings for 3 years without speaking, held the lobby door open as she reached it. "Heard it was a tough night," he said. "It was," she said. "You okay?" She thought about that. She thought about Reddick's blood under fluorescent lights, and Webb's voice on the phone, and Bradford Sims walking out of the building in handcuffs. She thought about the talk screen and the midazolam and 11 minutes in a supply corridor with Victor Hale. She thought about the female operative who had taken 2 bullets and kept her partner alive, and the look on Rourke's face when she said, "A witness we trust." "Getting there," she said. Oscar nodded, as if that were the correct answer, and let the door close behind her. She walked into the morning. It was cool, the particular cool of early summer before the day has had time to assert itself, and the light was low and angled, and the parking lot smelled of rain from some time in the night that she'd been too inside to notice. She stood on the sidewalk outside the hospital entrance for a moment, not moving toward her car, just standing. Her phone buzzed. An unknown number. She answered out of the specific reflex of a person who had been answering every call for 18 hours. The voice was one she didn't recognize, male, measured, with an accent she couldn't immediately place. "Ms. Ellison," he said, "I represent certain parties who have been monitoring tonight's events at Riverview Medical Center with considerable interest." A pause. "We'd like to discuss a matter of mutual concern before you speak with federal investigators again. I'd encourage you not to mention this call." She stood on the sidewalk outside the hospital in the early morning light. "You have 30 seconds, she said. "Then I'm calling Agent Rourke." A pause on the other end, shorter than she expected. "The male operative currently in your ICU, the voice said. "Room 9. He's carrying something that belongs to us, something that was not destroyed at Caldwell Station." Another pause. "We'd like it returned before anyone examines his personal effects." The line stayed open. She stood very still. She did not end the call. She stood on the sidewalk with the phone at her ear and the morning light coming in low and cool across the parking lot, and she made a decision in approximately 4 seconds, which was about 3 seconds longer than she usually needed. "Give me a number," she said. A pause. "Excuse me?" "A callback number. I need 10 minutes. Another pause. Longer this time, the kind that meant the person on the other end was recalibrating, had expected either compliance or refusal and received neither. Then a number, read out once, quickly. She memorized it. She ended the call. She immediately dialed Rourke. Rourke picked up on the second ring. "Ellison." "Unknown number just called me." Male voice, unidentified accent. Said the male operative in room 9 is carrying something that belongs to them. Something not destroyed at Caldwell. They want it back before his personal effects are examined. She paused. "I have the callback number." Silence on Rourke's end for 3 seconds. Then, "Don't move, don't call back. Where are you?" "Front entrance, sidewalk." "Stay there." Rourke was beside her in 4 minutes, Cahill a step behind. Mara gave them the number. Cahill was on a separate phone before she finished the sentence, running it. Rourke looked at the hospital entrance, then at Mara. "You didn't go back inside," Rourke said. "You told me to stay." "And you stayed." Rourke said it with the particular quality of someone filing information. "Most people would have gone straight to the ICU to check." "Most people haven't had someone try to use their instincts against them before," Mara said. Cahill looked up from his phone. "Number traces to a burner registered in Port Sterling, purchased 6 weeks ago." He looked at Rourke. "Same window as the first payments to Sims." Rourke turned back to Mara. "The operative in room 9, his personal effects. What happened to them on admission?" "Sealed evidence bag, standard protocol for federal patients. Locked in the charge nurse's station on the ICU floor." She thought about it. "Deborah would have the key." "We need that bag," Rourke said. She was already moving toward the entrance. But Deborah had the bag. She produced it from the locked drawer with the expression of someone who had spent the last several hours discovering that the night had layers she hadn't seen while it was happening and had reached a point of equanimity about it. The bag contained the standard inventory: wallet, phone, locked and badly cracked from the blast, a watch, and a folded piece of cloth that turned out to be a thin tactical sleeve, the kind worn against the forearm under long sleeves. Inside the sleeve, a data card, the size of a thumbnail, the kind used in specific military-grade recording equipment. Rourke looked at it for a long moment without touching it, then instructed Cahill to bag it under evidence protocol. The operative kept it on his person, Mara said, through the blast, through transport. His partner kept him alive through 2 gunshot wounds. They were both working to get this card out. They succeeded, Rourke said. The card went to the FBI forensic unit within the hour. Mara knew this because Rourke told her standing in the ICU corridor with the particular brevity of someone who has moved past a crisis point and is now in the long practical corridor of consequences. What the card contained, Rourke described it as significant, which was the most information she was prepared to give, was enough, combined with Holbrook's cooperation and the financial records from Sims' devices, to extend the warrant list by 6 names. 4 of them were in Port Sterling. The other 2 were not. The network Webb had been tracking for 2 years did not collapse in a morning. Networks don't collapse like buildings. They fray, from the outside in, one severed connection at a time. But the card started a process that the investigation would spend the next several months completing, and Mara knew this only in outline. The details were not hers to know, and she did not ask for them. What she knew, by 10:30 that morning, was this. Bradford Sims had been formally charged, transported to federal holding, and processed in the specific publicly documented way of federal arrests, which meant his name and charges appeared in the early afternoon news cycle with the institutional clarity of public record. The Port Sterling Courier ran it online by noon. Riverview COO, arrested on federal fraud and conspiracy charges. Following Caldwell Station bombing investigation. The photograph they used was his hospital ID, which had the particular irony of showing him in the exact context from which he had just been removed. Holbrook's name appeared in a separate item, smaller, the kind of story that runs adjacent to the main story and gets read by people who follow the details. Former nurse cooperating with federal investigators. No prior criminal record. The no prior criminal record detail was, Mara thought, the kind of fact that raised more questions than it answered, but she was not a journalist and she was not going to be one. She was asleep by 10:45. She drove home, which was 4 miles and felt like 40, and she sat on the edge of her bed for a moment to remove her shoes. And when she lay back, she was out, before the thought completed itself. She slept for 11 hours. When she woke up, the light in her apartment was the low amber of late afternoon, and her phone had 23 missed notifications, which she looked at without reading and set face down on the nightstand. She showered. She ate the first thing she found in her refrigerator that required no preparation. She sat at her kitchen table for a while without doing anything in particular. The thing about sustained crisis, she'd learned over years of it in different contexts, was that the crash afterward was never dramatic. There was no shaking, no sudden emotional avalanche, no movie version of a person processing something enormous. There was just this, sitting at a kitchen table in the quiet of a late afternoon, a little hollow, a little slow, existing at a lower voltage than usual until the system recharged. She'd done it before. She was doing it now. She was not sorry she'd stayed on the floor. She was not sorry she'd answered Webb's call or Rourke's questions or the unknown number on the sidewalk. She was not sorry about any of the decisions made between 9:47 the previous night and 10:45 that morning. She was, if she was honest, tired in a way that had nothing to do with sleep deprivation. Tired of being smaller than she was. Tired of the specific daily calculus of how much to show and how much to contain, of watching the space around her and deciding constantly what fit inside it. She had done that for 5.5 years, and she was competent at it in the way people become competent at things they do every day, but competence at something is not the same as wanting to keep doing it. She thought about what Garland had said. A different conversation. About your background, your training, what this hospital should be offering you. She sat with that. She went back on the 3rd day. Not her scheduled shift, a meeting which Garland had requested through a brief message that said only, "When you're ready, no rush." She wore civilian clothes. She took the elevator to the administrative floor, which was the floor she had never had reason to visit in 3 years as a night shift nurse, and she found Garland's office at the end of a corridor lined with the photographs and certifications of an institution that had existed for 40 years and was, despite everything, still standing. Garland was behind her desk. Victor was there, which she had not expected, sitting in a chair to the side in the specific posture of a man who is present as a participant rather than an authority. He looked rested. He also looked, in some less visible way, like a person in a different configuration than the one she'd known. She sat across from Garland. "Two things," Garland said. "In order. The first thing was the formal outcome of the internal review of Bay 1, which had concluded the previous afternoon. The review incorporated the security footage, the nursing records, the anesthesia notes, Rourke's preliminary report, and a voluntary statement from Victor that Garland described with characteristic directness as thorough and unflattering to its author. The conclusion: Mara's emergency intervention had been appropriate, correctly executed within the state's medical emergency exception provision, and authorized under the activated mass casualty protocol. The scope of practice complaint filed by Bradford Sims had been formally withdrawn from the hospital's records and flagged as initiated under duress and improper motive. No disciplinary action, no probation, no mark on her file. Garland said it in about 90 seconds. Then she said, "That's the administrative piece. You have that in writing." She slid a folder across the desk. Mara took it. "The second thing," Garland said, "is a proposal." The proposal was specific and had been clearly thought through. A newly created trauma coordination role, senior level, reporting directly to the Chief of Surgical Services. Scope of clinical authority expanded to include emergency procedure performance under attending oversight, protocol development, and training designed for the hospital's mass casualty response. A formal review of her military credentials toward possible licensing pathway in trauma surgery, if she chose it. Salary commensurate with the role. "You don't have to answer today," Garland said. "I know," Mara said. She looked at the folder in her hands. "I want to ask you something." "Go ahead." 3 years, she said. "I've been here 3 years. Why now?" Garland was quiet for a moment. "Because I didn't know who I had," she said. "And that is, straightforwardly, a failure of leadership. I run a department. My job is to know who I have." She didn't look away. "I should have asked better questions 3 years ago. I didn't. And I cannot fix that specific failure, but I can decide what this institution does with what it knows now." It was not a comfortable thing to say. She said it anyway, which was the most Mara could ask. She looked at Victor. He hadn't spoken since she arrived. "You submitted a voluntary statement," she said. "Yes." He said it without qualification or preamble. "What did it say?" He considered. "That I failed to respond effectively to a critical patient in Bay 1 on the night in question. That I was presented with correct clinical information by a nurse and chose not to act on it. That the subsequent intervention by that nurse was the reason the patient survived." He paused. "And that I had asked a nurse to stay in her lane on multiple occasions over a 3-year period, without adequate basis for doing so, in a manner that was professionally dismissive and potentially harmful to patient outcomes." The room was quiet. "That must have been difficult to write," she said. "Parts of it," he said. "Other parts were easier than I expected." He met her eyes. "I spent 2 years in academic medicine before I came to clinical practice. I was taught, in every environment I trained in, that hierarchy was functional, that the people at the top of a system were there because they were best equipped to make decisions." He paused. "I believed that uncritically for a long time. It made certain things easier to do." He stopped again. "What I saw you do that night, what I know now that you were doing every shift for 3 years inside a role that was a fraction of what you're capable of, that is an indictment of a system, not just a person. I'm part of that system." She didn't respond immediately. She thought about what it meant to hear that from him, and whether it changed anything, and decided that it changed specific things and left others unchanged, which was how it usually worked with reparations between people who had to go on working together. "I'm going to take the role," she said to Garland. Garland nodded once, as if she'd expected it, which she probably had. I want the licensing review, Mara said, and I want input on the mass casualty protocol revision. The response structure tonight had gaps that cost time. You'll have both, Garland said. Officer James Reddick was discharged from the ICU on the 4th day. He was not well, exactly. He would need outpatient follow-up, a recovery period, a conversation with a surgeon about the long-term implications of what had been removed and repaired inside him. He walked out of room 14 under his own power, which the nurses counted as a victory, and he seemed to count as simply the minimum acceptable outcome. Mara was on the floor when he came through. Not in the ICU, she was at the nursing station on the main trauma floor, doing the unglamorous work of reviewing the night's patient census with the incoming resident, the ordinary labor of a department on a normal day. She heard the elevator, and she saw him when he came off it, and she thought she could walk past and let it be, except that he saw her first. He crossed the floor to her. He was moving carefully, one hand not quite touching the wall beside him, the specific caution of a person learning the new terms of their own body. He looked at her the way he'd looked at her in the ICU, directly, without the social softening that people used to make eye contact easier. I wanted to say something before I left, he said. You don't need to. I know. He stopped. I'm a 12-year cop. I've been in bad situations before. I've been hurt before. He paused. I've never been in a situation where someone was specifically trying to make sure I didn't make it, and someone else was working just as specifically to make sure I did. He looked at her. The night I came in, whatever happened in that bay, I don't have the full picture, the medical details. He stopped again. But I've talked to the FBI. I've talked to the agents. I know enough to understand that I'm standing here because you made decisions you didn't have to make. She started to say something, the standard deflection, the professional I was doing my job that was technically accurate and personally a form of making herself smaller. She stopped. You're right, she said instead. I made those decisions. I'd make them again. Something in his face shifted. He nodded. Thank you, he said. Just that. Just the 2 words plainly, without ornament. She nodded back. He went to the elevator. She watched it close. The day Bradford Sims was formally indicted, 3 weeks later, on a Tuesday morning, the Port Sterling Courier ran the story on its front page with a photograph of the federal courthouse steps and a headline about the Caldwell Station investigation's widening scope. The charges included fraud, conspiracy, obstruction, and the charge that carried the longest sentence, attempted murder for hire, in connection with the targeted administration of a controlled substance to Officer James Reddick while he was a patient at Riverview Medical Center. Holbrook pleaded guilty to reduced charges in exchange for her full cooperation, which had been the operative fact behind most of the subsequent arrests. She received a suspended sentence and a permanent revocation of her nursing license. The network web's operation had been tracking for 2 years unraveled across the following months in ways that Mara only saw in pieces. An arrest here, a news report there, a brief text from Webb that said only 4 more this week. Card data held up. She kept those texts in a thread she didn't label. Victor Hale was not fired. This was the fact about the outcome that produced the most complicated response in the people who heard about it secondhand, which was most people. The board reviewed his conduct and issued a formal reprimand, which became part of his permanent file. He was removed from his administrative role as chief of trauma and placed in a senior attending position. Significant demotion in title and authority, unchanged in clinical capacity. He accepted this without a counteroffer and without involving his attorney, which Garland described to Mara in their first working meeting simply as his choice, with a tone that suggested she had opinions about it she was keeping private. Mara had her own opinion. She kept it in the same place. He was a competent surgeon. He had failed in a specific way on a specific night, in a way that was part of a larger pattern he had not examined. He was examining it now. That was not the same as absolution, but it was also not nothing. She had seen people in worse places refuse to move, and she had seen people in better places refuse to look. He was looking. She would watch and see what that produced. They worked together 3 weeks after the board decision, a multi-vehicle accident that brought in 6 critically injured patients on a Thursday evening. They worked efficiently, without friction, with the particular fluency of 2 people who had been through something together that stripped a lot of the performance away. At one point, she handed him an instrument before he asked for it. He took it without looking up, used it correctly, returned it. Nothing was said. Afterward, she was at the board, and he was doing his chart documentation, and he said, without looking up from the screen, "Good shift." "Yes," she said. That was all. She thought sometimes about why she had hidden. Not as self-interrogation. She was past the version of herself who had spent time in that particular room. But she thought about it as something worth understanding, because the reasons mattered and they were specific. She had believed, coming out of the service, that who she had been there was incompatible with who she wanted to be in its absence. That the scale of what she could do would make everything smaller than it should have been. That carrying all of it visibly was a burden she was imposing on the spaces she walked into. She had been wrong about that. Not completely. The instinct to protect the people around her from the weight of her history was not without value. But the execution had been wrong. She had not reduced her burden by making herself smaller. She had transferred it, invisibly, onto every patient who passed through her hands in a context where what she could do for them was artificially limited. She had saved James Reddick in spite of the box she'd built around herself, not because of it. She didn't carry that conclusion like a lesson learned. Lessons learned were too tidy for what it actually felt like. It felt more like a door she had walked through and could not walk back through, not because she'd burned it, but because she was not the person who fit through it anymore. That was different. That was simply change, the particular irreversible kind that comes from a night that shows you what you are when everything is on fire. She was Mara Ellison. She was a trauma specialist. She was 34 years old, and she had spent 5.5 years in a room that was too small, and the room was no longer small, and she intended to fill it. The first mass casualty protocol revision meeting was on a Wednesday morning. She sat at the head of the table with the previous protocol document in front of her and a pen in her hand and 8 people looking at her for direction. Some of them she had worked with for years. Some of them she was meeting for the first time. She looked at the document, looked at the people. "Page 1, she said, "we're changing the intake triage classification structure. Here's why." And she told them. Outside, Port Sterling was doing what cities did, moving, breathing, the unceasing ordinary motion of a place that had been through something and was not through with itself yet. Caldwell Station had reopened 10 days earlier, its security systems rebuilt, its central concourse cleaned and lit. People moved through it on their way to other places, which was what concourses were for. In a hospital 4 miles away, a woman who had spent years being invisible sat at the head of a table and was not invisible anymore. She had not needed anyone to rescue her. She had not needed the right person to finally see her value and grant it permission to exist. She had needed a night that was bad enough to make the box unsustainable. And she had needed, in that night, to simply do what she already knew how to do. That's the thing nobody tells you about being underestimated. It's not that the people who dismiss you are wrong about everything. Sometimes they see your size accurately. They just see it the wrong way around. They think they're looking at a ceiling when they're looking at a floor. You are not the diminished version of yourself that fitting in requires. You are what you bring into the room when the room is finally in enough trouble to need all of it. Mara had always known what she carried. Now she carried it openly. And every life that passed through her hands, every patient stabilized, every decision made in the hard quiet of a crisis, every protocol written for the person who would need it in a future emergency she couldn't predict, every one of those was the answer to 3 years of stay in your lane. She had stayed. She just wasn't staying anymore.